couple of weeks ago, I underwent septoplasty surgery, which is great because maybe I'll be able to breathe now after years of having problems with that. One of the things is that I cannot really lift anything heavy for a while. I cannot really do anything strenuous, and I'm not even supposed to bend down to pick up things. But I'm also itching to do some training, so I figured I'm gonna do some super light stuff, something more of a volume based, something light. If you found this video, chances are that you were looking to find some information on how you will recover from septoplasty. In my case, it was pretty good. The first week I was very tired and I was getting winded very quickly. And I slept most of the first week. Second week was much better. So now I'm on day, I think 15, 16 since the surgery, and I'm feeling quite good. I'm still getting tired quickly. My nose is still swollen inside, but it's definitely better. Like, I didn't really have any complications. Like, some of the complications that you could expect would be bleeding. Basically, it's not healing. I didn't have anything like that. There was definitely a lot of swelling. So, like, the first 3 or 4 days were probably the worst. Like, my glasses hurt when I was wearing them. Like I could see my eyes being really swollen. But yeah, it started going away. The pain is still there a bit, so I can still feel a bit of pain, like at the front of my teeth. It's not as bad as the first few days, but I can still feel it. Yeah, I mean, other than that, like it seems to be healing fine. Some of the information from the hospital was saying that the healing can take up to 3 months, so I'm gonna have to pace myself. As for the logic for my selection of exercises, basically what I wanted to do is just some push-pull. Don't really feel like training legs. I cannot do any deadlifts. I'll probably just, like, if I leaned over and tried to pick up just the plate aside, I would burst my nose. So something where I don't have to do Valsalva maneuver, something where I don't have to really hold my breath. So yeah, simple things like pressing and pull downs. Quick to set up, easy to do, safe with dumbbells. The weight selection is I just basically went around 30% of my max, so really light, and then 5 times 10 is like a decent amount of volume. It's not really strenuous, so I'm not gonna feel it too much, not gonna tire me too much. I'm trying to rest at least a couple of minutes between the sets, which is the time where I'm talking. Should be sufficient. So far, like, I'm 2 sets in, I'm feeling quite alright. Like, it feels nice to move, even though I'm starting to feel my elbows. Like, historically, my elbows are not great either. Like, I had an accident many years ago, so I cannot fully extend my arm. So this, if I don't train for a few weeks, I really start feeling my elbows and my back. Who would have thought, okay, if you don't want to be in pain, you have to train. But yeah, so far it feels good. I can sense that probably after the 5x10 on push and pull, I'll be sufficiently tired. It's not a great workout, but I'll be definitely tired. Like, I can feel it already coming. Right, we're approximately 20 minutes later since I started, and I'm done. It felt great. It felt good. Slightly winded, sweating a bit is good. It feels amazing. I'll have to take it easy for the next few weeks. But yeah, I was itching to do some lifting, and it feels like it was worth it. It's so good. Take care, people.